Next up, we've got Emma Brookes, who's going to address the delegation. Emma can't be here in person. There's a bit of a family problem, but she's quite kindly agreed to do a live session for us. So let me introduce you to Emma Brookes, Head of Soft FM Strategy and Operations at NHS England Improvement, talking about the cleaning standards.
Hi, thanks, Paul. I hope everyone can hear me. Real apologies for not being there in person, but thanks to the wonder of technology, we can do this all via video link. Hopefully everyone can hear me all right. And without further ado, I know a lot of you have probably been listening to this presentation or similar presentations for the last 5 years, but we just want to run through where we are now and what's going on with the implementation of the new National Standards of Healthcare Cleanliness 2021. Essentially, we've got quite a difficult environment. We've always had a difficult environment, but over the last couple of years, it has been a really challenging environment to cope within. We've got a fragile market. The NHS landscape is ever changing. We've had Brexit in between all of this. We've got a variability in cost and quality of services. There's a real sort of like constraint on trust resources. We're seeing increasing activity. And of course, COVID-19 over the last couple of years has really made a huge impact on what we do and how we do it. There's a huge task at hand. In 2019, we were cleaning an area the size of Gibraltar 3.5 times a week. That's only got worse over the last 2 years. So that's just to give an indication of what we're dealing with on a day-to-day basis. So a bit of background to the new standards. Essentially, this is not something we've done overnight. It wasn't a really quick project. We started in December 2017, looking at the last set of standards that were done in 2007. There'd been, 10 years where they hadn't really properly been looked at and reviewed. So during October 2018 and January 2019, we ran a pilot. And we made huge changes from that. What we'd started from the premise was looking at the best of the 2007 standards, the best of the PAS 5748, and looking at what we could incorporate to give a truly sort of flexible but standard way of working across different sectors of healthcare. When we ran the pilot, there was a lot of changes that were made from that. We had 30 trusts that took part across England and Wales, and that also included primary care colleagues and care home sector as well. And we received quite a lot of comprehensive data that allowed us to look at what would work out in the real world and what really didn't work. And from that, we could take all of those comments together and make the amendments to the documents to start to make the real change. The document was changed, reviewed, looked at, reviewed again, and went through various iterations before we sent it out to the sector to get comments on what we're doing. And that included a sort of parallel for people to work between whether they were working on 2007, some of the 2014 amendments, PAS, etc. And we took on board comments from, over 80% of the NHS who commented back on where they felt things needed to change or that things weren't quite right or just the terminology didn't quite sit right. So again, we went back to the drawing board and kind of looked at everything, looked at all of the comments, looked at what we could change, what we couldn't change, and we provided feedback across the board for that. Then we had COVID came in, obviously, but then in May of 2021, we were actually able to launch the new cleaning standards. We know there was a lot of call for this. It was out there in the ether for such a long time. People were really keen to get this out. So in May 2021, we were actually able to launch the standards. We ran a number of webinars, national webinars throughout June to support organisations with their implementation and create FAQs. We also took on a number, and we're still doing that to this day, of localized calls and presentations, whether that be for CCGs, for trusts individually, just generally trying to support them to be able to implement the standards or understand some of the quirks and changes in the new standards. Central support is ongoing and it will continue to be ongoing. So we're just butting up now against the initial compliance date for mental health trusts and acute trusts of the 4th of May. And obviously all other sectors should be compliant by November of this year as well. So essentially, when we looked at what did we want to do around the new cleaning standards, there was a number of factors that we looked at during this. So part of it was collaboration. It was about a collaborative approach being essential so we can continuously improve our cleanliness and ensure that we have the right, safe, clean environments that we should have. It was about transparency and insurance. So ensuring that we made sure that we were giving that assurance to patients, public and staff that safe standards of cleanliness have been met in every organisation. Infection prevention and control. We know these two things go hand in hand. It's a vital part of infection prevention and control. It helps us to ensure that we are providing clinically clean and safe environments for delivering patient care. And it's also about that continuous improvement. So challenging organisations to look at things slightly differently, to show that we're combining the mandates of the new document with guidance, recommendations and good practice to support organisations to look at what they're doing and look at how they can do it differently in order to deliver the best possible cleaning service that they can for the patients, the staff and the visitors as well. So from a point of view of the highlights around the documents, so these new standards are designed to reflect modern methods of cleaning, but it's important that we pick up on lessons over the last couple of years. So there's now important considerations for organisations to think about their services during a pandemic, during an outbreak, or any things that are outside what we would call normal cleaning conditions. The standards emphasise transparency and they focus on the need for a collaborative approach, and that is really important. It's about working in partnership with your FM provider, with your in-house services, with estate services, infection prevention, our clinical colleagues, to ensure that we've got a service that is right for that trust and the demographic of patients you're dealing with. The published ratings reflect the cleanliness score for a whole area. It's not about us, saying so-and-so is not doing their job. It's about cleaning is cleaning. It doesn't matter whose responsibility it is. We need to ensure that every single member of that cleaning team, and that does include clinical colleagues, it does include estates colleagues, porters, and a variety of other people, that actually everybody is responsible for that, and we all need to come together to make the right environment. If you walk down a corridor and you see a tissue sitting on the floor, is it someone else's job to do it? No, you've seen it, let's pick it up. It's everyone's responsibility to make sure we have clean and safe environments. The approach makes it clearer to the patients, staff and visitors, and it inspires people within trusts to work together to achieve high standards of cleanliness. We now have a good suite of documents. So we have the standards of healthcare cleanliness. We have appendices that sit behind that and give a variety of different tools and information. We have some guidance that sits alongside it. Health and safety, really important, how we clean. And pest control, it does go hand in hand, how we control our pests and how we keep our environment clean. And we have the healthcare cleaning manual, which I'll be telling you a little bit more about later on in the presentation. So the highlight changes, I'm sure all of you are really familiar now, having worked with this since the 4th of May on what the changes are, but to give a bit of a highlight, we updated the risk categories from the original 4 to 6 to give more flexibility across different sectors. We looked at the elements and we changed those. We now have 50. I know everyone has been very used to calling it a 49 elements audit. but we looked at those and reviewed them and settled on a number of 50 elements. The responsibility framework that's been around for some time now, we now have given you suggested areas of responsibility. It doesn't mean you need to use those, but it does support those trusts that were perhaps struggling to decide where their responsibilities should lie. We looked at audit. Audit is a really clear one. We tended to be in a position where we were, going out and doing a technical audit, and that was then followed up by a manager doing the same technical audit, and then we had the external. And that following on of audits was not necessarily the best way of going. If we want to prove that we actually are doing the right things, we need to show that we are training our staff correctly, we're using the right chemicals, we're using the right processes, we're cleaning what we should when we should. So the efficacy checklist was brought into being in place of a second point of doing exactly the same audit. Star ratings are a new thing. For a long time, we've been displaying our percentage scores, but it was felt that that doesn't necessarily mean much to patients out there, sometimes staff as well, and star ratings are quite easy to understand. It shows what we're doing in relation to the risk and makes it a much more transparent process. And then, of course, we've got the star rating escalation process. So this is about taking everything that we do and ensuring that we review that on a regular basis. So if we are falling below a 4-star rating, why are we doing that? Have we got staff that haven't been trained adequately? Do we not have the right equipment in place? Has an area changed its use? So sometimes we know at short notice, an area can change its use from one type of clinical service to another. It's the nature of what we do. So it's about, has that happened, but then we haven't reviewed the cleaning regimes. So it's about how do we review that and ensure that we are continually improving our cleaning services. We've also got these cleaning commitment to cleanliness charters that will be displayed through all healthcare organisations. Obviously, there will be minor changes depending on the sector in which you work in, but the idea is that, I said earlier, cleaning is everybody's business, but that also includes visitors, patients, and public. We know at times, people have accidents in a toilet, and if they can tell us that it's happened, we can get there and clean it before someone else has to experience it. If we don't know about it, the first person that knows about it is the next person using that. So this is a way of us showing that we rate this with importance. We know that there are things that we need to do, things that patients and public and visitors need to do, and things that our chief execs and everybody else across the board need to do as well. It also replaces the need for work schedules in the same way, because most people don't need to know that a cleaner will be there at 7 a.m. cleaning a toilet, because often the very nature of what we do means they might get pulled off to do something else that's more urgent at that particular time, and they'll come back an hour later to complete that clean. So it's about the frequency. How many times can a patient expect the toilet next to their bay to be cleaned in a day? Is that once? Is it twice? Is it 3 times? Is it more? And that's the important thing that we need to do, as well as alerting people to whose responsibility it is. This should help to give, again, transparency and confidence to patients across the board that they're able to see the same type of cleanliness charters in every single organisation. This is an example of a frequency gap analysis that we've shared with many organisations. We can share it with anybody who hasn't seen this, but it's about the ongoing work to ensure where you are or where you were a year ago to where you are today, and what those differences look like. Where was your starting point? Was it 2007? Was it 2001? Was it something completely different? Was it PAS? So it helps organisations to show where there are changes, where the standards are improving, going down, or just a completely new standard as well. And there's a lot of work ongoing currently with various sectors of healthcare to align everything. So at the moment, these standards are not for ambulance trusts. We are doing a bespoke piece of work with all of the ambulance trusts in order to produce the same standards, but in a way that is suitable for them. And equally, there is a large amount of work going on in the background to support primary care and care homes in implementing the new cleaning standards. The big news is the updated cleaning manual, which I know has been long awaited, which carries out, it has obviously our general cleaning principles, but it also has a number of written methodologies. The posters, you can see a picture here of the posters that you can use, you can download, you can print, you can put up in various places, but also bite-sized training videos. So each of these posters is linked to a video that you can use to help support training of staff in how to carry out each individual item, and we hope will form part of their training program in the long run. And these will all be available as of the 4th of May via our Estates and Facilities Hub initially, but also through professional associations and our FM providers. So that is all going to be going live very, very shortly. Again, has been quite a long time in the making, but it is a large improvement on the previous cleaning manual that we've had around for some time. I'd also like to talk as well very much about how people have implemented and how they have worked in partnership. So I'd like to talk very briefly, because I know Anna Hallis will be giving a talk this afternoon about Royal Surrey, and we'll go into a lot more detail. But I think for us, it's quite key that we've got Royal Surrey who've worked really closely in partnership with their contractor MediRest and looked at how they can engage with the infection control teams, with the board, with everybody in order to develop the right cleaning policy, get everything signed off, looking at who's the board representative, looking at the risk categories, cleaning frequencies, responsibility frameworks, cleanliness charters, and work closely together to ensure that by the 1st of April this year, they had fully implemented the new standards. And I know Anna's going to talk about that in a lot more detail, but I think from our perspective, Royal Surrey, if anyone has any questions on how it's done, Royal Surrey is a really good site to talk to, maybe pop along and visit as well, as to how they've managed to do this implementation within this period of time as well. There's been a really key partnership between the Trust and MediRest in order to make sure that things are done right, not just for the standards and for the compliance, but also for the patients, for the staff, and for the site itself. So that generally, I'm not going to steal Anna's thunder on this one, but that is generally where we are currently.